The Indonesian healthcare system has made progress in expanding access and coverage, with the national health insurance now covering the majority of the population. However, the system faces significant challenges. Health expenditure remains low, limiting service quality and coverage. High out of pocket expenses creates financial barriers, particularly for low income groups. There are substantial regional disparities in access and resource allocation, resulting in inequities between urban and rural areas. However, despite these issues, Indonesia has the opportunity to build a more equitable and efficient healthcare system by addressing these gaps. Our analysis will now cover the following topics on this slide in more depth. Indonesia's health system faces significant challenges but has opportunities to leverage economic growth, decentralization, and technology to address disparities and build a more sustainable future. Starting off with Indonesia's demographics, with over 240 million people and a young median age of 27, Indonesia is experiencing urbanization and a growing working age population, which can boost economic growth. However, the dual burden of infectious diseases and rising NCDs does strain the healthcare system and is therefore important to address. There are opportunities to develop chronic disease management systems and leverage international partnerships. Moving on, Indonesia has a decentralized government. However, there has been inconsistent implementation and regional inequalities. Therefore, creating localized initiatives can help address regional needs. Economically, Indonesia is experiencing strong growth, but healthcare expenditure remains low, with high out of pocket spending limiting access. However, there are opportunities to expand universal health insurance, which can improve equity. Moving on to socio-cultural factors, Indonesia's diversity shapes health behavior and caregiving dynamics. For example, vaccine hesitancy and misconceptions about medical care can hinder public efforts. Therefore, creating targeted health campaigns can address cultural sensitivities. Indonesia is vulnerable to natural disasters and climate sensitive diseases, which strains resources. Therefore, innovations like telemedicine can help improve access. And lastly, Indonesia has high internet usage, but IT adoption in health is limited. Therefore, there are opportunities to enhance telemedicine and digital platforms within healthcare. This slide presents a dynamic analysis of the key contextual factors impacting the Indonesian health system, evaluating the degree of impact from high to low and the time horizon from short to long term. Overall, it highlights Indonesia's need for immediate action in economic, epidemiological, and technological areas, whilst preparing for long term demographic and socio-cultural challenges.
Indonesia's healthcare system has made substantial progress, with life expectancy rising to 71 years and declining infant mortality. The 2014 launch of national health insurance marked a major advancement. However, gaps in financial protection and inconsistent healthcare quality across regions remain, creating inequitable financial burdens and access issues. An aging population and rising non-communicable diseases further worsen urban-rural disparities. Persistent challenges, including low health expenditure and regional inequities, undermine service quality. Addressing this requires improved resource allocation and a shift from curative to preventive, sustainable strategies. This page highlights Indonesia's health expenditure trends and comparison with regional peers. From 1995 to 2014, Indonesia's health expenditure grew but remained behind its peers. It allocates only 2.9% of its GDP to health, far below others. This number emphasizes the need for stronger public investment and a focus on preventive care to bridge these gaps by reducing financial burdens and improving outcomes. Patient satisfaction in Indonesia's healthcare system is mixed, with surveys highlighting disparities and misaligned policies. Significant equity challenge persists as urban-rural and ethnic disparities leave minority and rural groups with poor health outcomes. Efficiency issues such as an emphasis on curative over preventive care, drug procurement inefficiencies, and low technical performance have led to financial deficits in the GKN program. Illegal drug sales and weak regulatory control further undermine healthcare quality. Comprehensive measures, including stronger regulations, better resource allocation, are essential for long-term system improvements.
Indonesia's decentralized healthcare system, as depicted in the diagram, allows for local adaptability but also leads to inconsistent service quality across regions. While public hospitals and clinics are vertically integrated under national policies, the diagram highlights the challenges in achieving effective horizontal integration, with coordination gaps between different providers and level of care. This fragmented decentralized government model, as shown in the diagram, contributes to resource disparities and uneven health outcomes, particularly disadvantaging rural and underserved populations. Moreover, it indicates that the national insurance faces sustainability issues with financial constraints and administrative inefficiencies, limiting its ability to ensure universal coverage. Indonesia healthcare financing combines government fundings, social insurance or JKN, and significant out-of-pocket payments, while JKN aims for universal coverage but constrained by regressive patient payments, administrative issues, and inequities excluding informal workers. Geographical disparities exacerbate access, while JKN sustainability is strained by low premium, high costs, and rising prices. The progressivity graph or Kakwani index shows JKN becoming more progressive, but out of pocket and private insurance remain regressive, underscoring the need to address these financial inequities. The Lorentz and concentration curves highlight significant inequities in Indonesian healthcare financing. The Lorentz curve shows unequal healthcare consumption, while the concentration curves reveal that JKN is the most progressive source, unlike the regressive out-of-pocket payments and private insurance. These high insights underscore the challenges in achieving universal and equitable access, emphasizing the need to address financial disparities in Indonesian healthcare systems. The graph shows Indonesia's per capita healthcare expenditure steadily increasing from $25 in 2000s to 161 in 2021. It's a 20.50% jump from 2022. This consistent growth indicates a sustained commitment to strengthening the healthcare system and improving access to services.
Indonesia's public health services are funded by central and local governments. The Ministry of Health supports programs like maternal care and vaccinations, while local governments contribute through DAU and DAK funds. Launched in 2014, the National Health Insurance aims for universal health care funded by government and members. However, disparities in structure and services, especially in underdeveloped areas, challenge equity. Rural regions often face shortages, with the chart shows on the right the funds transfer including tax revenue sharing, natural resource profits, and special autonomy funds. Indonesia's payment system includes payment mechanism and third-party payments. Public health funding uses capitation, fee-for-service, and INA CBGs for specialized care to control costs and ensure equality. Health workers pay varies by setting and includes incentives. Third-party payments from insurance like USKs and James Tech complement government support. Payment methods vary by provider, aiming to ensure equity and quality in healthcare. Indonesia's healthcare services are provided by public and private sectors. Public facilities including 9,600 Puskesmas for outpatient care and public hospitals for advanced care, while private sectors, most urban, offer cost-tier services. Rural residents rely on community doctors and traditional healers. Despite accreditation, urban areas have more resources and rural regions lack basic services. The Ministry of Health enforced treatment guidelines and competency exams to address disparities and improve quality.
To address Indonesia's health challenges and achieve universal health coverage, five key recommendations are proposed. First, it's essential to increase public health spending to meet WHO recommended benchmarks, secure international funding, and enhance budget efficiency through targeted plan and strict auditing. Second, reducing regional disparity requires decentralizing resources allocation, incentivizing healthcare workers to serve in underserved areas, and expanding telehealth with improved digital infrastructure. Third, tackling the rising burden of non-communicable disease involve implementing preventive programs that promote healthy lifestyles, early screening, and integrated care models focused on managing both chronic and communicable disease. Fourth, financial protecting can be strengthened by expanding JKN coverage for vulnerable populations, increasing subsidies to lower out-of-pocket costs, setting co-payment caps, and introducing communicable health insurance in unserved areas. Finally, improving system efficiency calls for reallocating funds towards preventive care, scaling up public health initiatives like vaccination and sanitation, fostering public-private partnerships, and incentivizing efficiency through performance-based payment systems. These measures aim to create a more equitable, efficient, and sustainable healthcare system in Indonesia. Thank you so much for listening.